cases of COVID-19 in the community, and we have 6 new positive cases in managed isolation to report. All of those were identified at day 01 testing on arrival into the country. We have got 2 people from managed isolation facilities who are currently in Auckland hospitals. The second of these is one of our new positive cases we're reporting today and was taken to hospital last night. We still don't have confirmation as to whether that's COVID-19 related or related to another condition. I'm advised all infection prevention and control, IPC protocols were and are being followed, of course, and both patients are stable. And hospital staff are now well used to providing care for COVID cases, and the hospital is safe for both staff, patients, and anyone who needs to visit or attend outpatient appointments. On the testing front, we had another big day of testing yesterday with 14,671 tests processed, and of those, 7,853 were across the Auckland region. That takes our 7-day rolling average to 9,721. There are 11 community-based testing centres open in Auckland today again, and a reminder that people can also get tested at their GP or at an urgent care centre. There will be pop-up testing today at Ngā Whare Wātea Marae in Mangere, and the Auckland DHBs are working closely with Turuki Healthcare there. Today, our contact tracers are focusing on further follow-up of close contacts, all of whom have been tested already once and returned negative, and close plus contacts related to the MIT and City Fitness locations of interest. Since Monday, 45 home visits have been undertaken by welfare providers in Auckland in partnership with the local public health service. And I should say that in all 45 of those visits, the people whose homes they visited and who were expected to be isolating were isolating. Of the 185 attendees at City Fitness in Hunters Plaza on the 26th of February, these are all identified as casual plus contacts. 156 of them have returned a negative test, and there are 29 people who are due for testing, and we are following up those results today. Likewise, at MIT, there are 44 casual plus contacts from the 22nd and 25th of February. 2 have returned negative day 5 tests, and all have been successfully contacted. The other 2 who haven't yet returned a test result, that is being followed up. On the Kmart front, of the 1,882 people who were at that exposure event, that is, visited the Kmart on the 2 evenings where one of the cases was working, 43 have not yet returned a test result. 42 of these have actually we've been in touch with, and they are complying with isolation requirements and are being actively supported to have a test. If they can't get out and about to do that, then we can send a mobile testing centre there. And finally, on Papatoetoe High School, in terms of contact tracing, there are 11 high school students we don't have a second test result on yet. 8 of those were visited yesterday. They are from 6 separate households, and mobile testing vans are taking tests from them today. 2 of the remaining students have refused the test, and they are being managed with isolation plans by Auckland public health officials. And there is 1 outstanding student that contact tracers are working actively to find, but I should say that student is known of because they also have previously returned a negative test between the 15th and 19th of February. On the wastewater testing front, further results from ESR testing have been returned, and samples taken on Monday at 3 Auckland sites, which include wastewater from Papatoetoe, have come back negative for the virus, and samples from Christchurch and Rotorua were also negative. We'll report further testing results as we get them. On saliva testing, which I know there is keen ongoing interest in, we are continuing to trial this in our quarantine facilities and investigating how it can add value to our current surveillance testing regime in New Zealand. I just saw yesterday actually a report from the Australian Public Health Laboratory Network with their conclusions around the use of saliva testing. And like us, their view is that in a very low incidence situation like we have in both Australia and New Zealand, that the nasopharyngeal PCR-based test is still the one to use, but that saliva testing can play a role in surveillance testing. In other words, the asymptomatic testing we are doing of our border workforce in particular. And at this stage, that's our view as well. We are doing the trial in our quarantine facilities, but also working with 2 or 3 private providers who have established saliva testing and now validated that with one of them, and most likely we will. We're planning to see if we go into an arrangement with one of them to look at using this as a complementary testing method in our border workforce. Healthline continues to be busy. We'll publish the numbers on our statement. The longest wait time yesterday, that I can say, was 11 minutes. Finally, on our vaccine program, which continues to roll out, including in Tamaki Makaurau, despite alert level 3, we have got more than 800 vaccinators now around the country who have completed the specific training module for the COVID-19 vaccine, that is to use the Pfizer-BioNTech vaccine. So that is going well. To date, there are 13 district health boards now rolling out immunisation programs across the motu, including all that have a port or an airport, of course, to capture that border workforce. And we're making our way through the MIQ staff. And by midnight last night, we were over 2/3 the way through that border workforce, having had their first vaccination. So good progress there. I'm happy to take questions.
With no new cases in the community again today, is Auckland in alert level 3 still justified?
At this point in time, yes, it is. And the main reason being there that the reason we gave advice around using alert level 3 in Auckland was because we had, in case N, an active case who had been in the community for nearly a week. And the last significant exposure event was on that Friday afternoon at the gym. And we're not yet a week on from that. Yes, we have found many of the people who are at that gym, they're all casual plus contacts. And so far the testing is promising, but there is still some who we need to get test results back on. And of course, we need them to remain isolated until we get those negative test results.
So now is not the time really for Cabinet to be reassessing whether we jump out of those alert levels earlier?
No, not today. And they are planning to meet tomorrow afternoon with our advice and make a decision about whether alert level 3 continues beyond when its current one is due to expire, which is later on Saturday evening.
What are the key pieces of information that will inform your advice to Cabinet?
Look, so there's a set of criteria that we always report on, and some of those are fairly routine around lab capacity, and we've got very good capacity in our labs, around 25,000 tests we can process each day. They're around contact tracing capacity. So we always provide advice around those 2 things. But the key things that we're looking for is, as has been noted, not just the fact that we haven't got cases from the close and casual plus contacts in these potential exposure events, but also, and this is a really important part of our advice, is the wide testing that's happening both in Auckland and outside that will increasingly provide assurance that we haven't got onward transmission into the community. So those high rates of testing over the last few days have been incredibly helpful, and we want to maintain pretty high rate of testing over coming days too.
And so is it possible that we do record new community cases tomorrow but still are ready to move alert levels?
It would depend where those community cases were from, and also, of course, now we can rapidly get the whole genome sequencing, being able to both epidemiologically and genomically link them back to our existing cases. Remembering though that all our 15 cases we have got are within 4 families. All those families are contained, including the most recent one in the Auckland quarantine facility. And really we're just going back to see that before they were moved there, that just to confirm that there was no onward transmission.
And so if you had those links, then potentially we could still move alert levels?
Yes, it's the nature of any cases really that come up. But I think increasingly with our negative test results in Auckland and outside of Auckland, because the key reason for putting the rest of the country outside Auckland into alert level 2 was because there had been a lot of travel over that period of week, clearly a lot of people travelling between Auckland and the rest of the country. And we just needed to be sure that there hadn't been seeding of this outbreak outside of Auckland.
Case N, who went on the walk with another case during level 3, they were originally thought to, when they tested positive, to have only been infectious for the few days prior because they were asymptomatic when they tested positive. Have their contacts going back further now been traced? Because we know that they were likely the person who infected case M, a week before we first thought they were infectious.
Yes, so yes, we we have gone back, or the contact tracers have gone back, and just there weren't any other exposure events for case N. The main one was in the workplace, and so all the workplace colleagues were close contacts, and they were quite quickly isolated, and they've all tested negative.
Has it been confirmed that walk was where exposure occurred?
It fits very much fits with the timeframes that the person who would have infected case N was infectious, and so there's, in terms of the timing, the epidemiological link, and the genomic sequencing. Yes, it's a.
Yeah. Can you talk more about the arrangement you're coming to with a company with saliva testing? Yeah. Like, what's the company? How far are you going to roll it out? What's the framework there?
Yeah. So what I can tell you is we had already been looking over the last 3 weeks at. There is Raco is one of the companies that we know is willing, ready, and eager to go, but they're not the only one. So what we're planning here is, alongside our trial of voluntary use of this inside our quarantine facilities at the moment, is to look at, probably we will go out to the market and with a request for proposal process to see if there is a company who's prepared to provide complementary saliva testing as part of our border workforce testing. And the evidence out of Australia, or actually from the Raco test from the University of Illinois, I think it is, where they used it, is that probably twice a week it doesn't need to be daily, but probably twice a week, complementary to the ongoing weekly or fortnightly nasopharyngeal swabbing. So early days, but the next step is likely to be we would use an RFP process.
Right, yeah, because the way before, I thought you were in arrangement with a specific company already, or that you were looking at one company, but you're putting out the tender offer.
That's right. There's one company that's been very active in promoting its product and so on, and that's. But there's no, and we have been actively engaging with that company, but there's no commercial arrangement at all.
Why the shift in thinking? Why move towards the private providers as well, figuring you've already running this trial of your own test?
The main reason is that actually the saliva testing still uses the PCR laboratory process, so it's still a PCR test, and so our current labs are, there's quite a lot of work that they have on with the current testing right across the country, as well as the surveillance testing. So the idea would be, if we can get to an arrangement with a private provider, remembering that a good proportion, probably 40% of our nasopharyngeal swabs have been processed right from the start through private laboratories. So we've had private laboratories as part of this right from the start. But it would be so that we don't disrupt or compromise any of our current testing capacity, especially when we need to use that in a situation like now where we need to have that surge capacity online.
On the trials for the nasal swabs, do you have any sort of numbers or metrics around how many people you'd want to try that on before you'd sort of deem successful?
So you mean the saliva testing?
Yeah.
Sorry,
the saliva
testing.
testing.
So I guess we've now validated, I would say, validated the science. Let's say what the Raco in particular had put forward is the accuracy of the test compared with using a nasopharyngeal swab. I guess what the trial is about is really about acceptability and the practicalities of getting the samples, getting them to the labs alongside the existing IPC and testing protocols in our facilities. So that's just giving us some useful information about what's the simplest process to establish to be able to then incorporate saliva testing as part of the ongoing surveillance.
Do you have a time frame for those trials, or when you expect them?
Well, they're ongoing at the moment, and I don't have a time frame for when that RFP might be going. The request for proposal might be going out, but it's actively underway.
What would you like to see over the next 24 hours in terms of being confident of moving down the levels at the weekend? And what at the moment are your biggest areas of concern?
So I think what we will be looking for over the next 24 to 48 hours, right through up till the final decision, is continuing that our close contacts remain in isolation, and we've got that at the moment, and the first tests were negative. That's good. I'd like to see the tail of those casual plus contacts, particularly from the gym visit, which is the last of the visit of the sort of big exposure events, last Friday afternoon. We'd like to see those test results coming in, and we're actively chasing those. And then, of course, just not seeing any other cases pop up from the testing across the community, because we're pretty confident now we've got a sharp perimeter around this particular outbreak. All those things will give us confidence that there hasn't been onward transmission.
It sounds like there are some individuals who find it hard to contact or who are refusing tests at the moment. Is that concerning, or is it not? Because
It's not really concerning. I guess, just to come back to our high school, where we had extraordinarily high rates of testing amongst the students and staff, not just the first time round, but also for that follow-up test. And I mean, this has been the case right from the start, that the vast majority of people who understand what's required do voluntarily get the test done, and of course isolate. And again, right from the start, this is not an enforcement-based approach. And I think we saw this morning that police released the data that I think they've done 1,000 prosecutions since March last year. And my understanding is most of those are for overt, repeated breaches of alert level expectations. But the vast majority of people are doing what's asked of them. And I understand all the data around traffic volumes and so on in Auckland is the same this time as it was in August in the alert level 3 that was in August as well. So people know what's expected and they do it, and that's how we've been successful. So
With the vaccination program, there's been some push for the South Auckland community to be prioritised for vaccines. Is that something that you would like to see happen sooner for that group?
What I can say is it's something we're already thinking about. And one of the reasons here is if we think about our border workforce, which is the majority of them are based in South Auckland, and also the fact that the last 2 outbreaks we've had in the community have been in South Auckland, we're putting a layer of protection by vaccinating that border workforce and their whānau. And then I think it makes sense that very early on, when we start to roll out further, the next layer of protection out would be to not just protect that community, but we would be protecting the wider country by vaccinating that community. So I've asked the team to start doing some thinking about how we would, when we start that wider rollout, go first into the South Auckland community. Absolutely.
With